Good afternoon, everybody. I'm Daniella Levine Cava, County Commissioner, District 8, and we're bringing you another episode of Our Community Cares in the post-coronavirus world, I guess the current coronavirus world. I'm sorry for technical difficulties. We were a little delayed and hope that you've stayed on and been patient with us. We certainly are all learning a lot of patience in this new world. So we've been bringing to you for almost 3 weeks a series of conversations with some critical players, actors in our community who are showing us how to cope with the coronavirus, with COVID-19. And we've heard from people about job reemployment. We've spoken about small business issues. We looked at renter assistance and unemployment compensation, mental health issues, labor issues, healthcare employment issues. We have been quite comprehensive in our reach, and we will continue to bring you really critical topics every Monday, Wednesday, and Friday at 4 p.m. These will be archived on Facebook, so please tell your friends and neighbors virtually to join us. And today we are really, really thrilled to bring on a wonderful lady, a wonderful advocate, Liz Regalado. I have known Liz personally for several decades. Liz and I have worked together on issues of community well-being, children and families issues, and I'm really thrilled that Liz is going to be talking to us specifically about something that unfortunately is very prevalent in our society, in the world, all the more so as we are all staying home, which is domestic violence. We are seeing a huge increase in incidents of domestic violence, and even the the United Nations Secretary General has called upon the world to be vigilant and protect people in their home. Not only are we sheltering home, but we're under tremendous pressure, economic, mental, physical, and this unfortunately is leading to a real uptick. So we're going to hear from Liz, who is the Executive Director of the Miami-Dade County Domestic Violence Oversight Board. It's part of the Office of Community Advocacy in our Board of County Commission office. So welcome, Liz. It's a pleasure to have you join us. And I want to thank you for everything that you do and the Office of Advocacy does in our Miami-Dade County Board of County Commissioners. And you have had such a positive impact upon our community. So why don't you start by telling us a little bit about the Domestic Violence Oversight Board and the responsibilities to the community.
Thank you. First, I'd like to thank you and the entire Board of County Commissioners, as well as the mayor, for making domestic violence a priority in this county and ensuring that Miami-Dade County has a coordinated community response to domestic violence that is formidable and strong, and it responds to the needs of the residents. So the Domestic Violence Oversight Board was created in 1994 in the heels of when this county established and levied a food and beverage tax for restaurants and establishments that have a liquor license and serve food, and the alcohol is consumed on the property, on the premises. And it's a 1% tax, of which 85% of that tax goes to 85 cents of the penny go to fund homeless services, and the other 15 go to fund the construction of new domestic violence shelters and their operations. So that's the Domestic Violence Oversight Board was created right in the heels of that tax to ensure, A, that the county has a good response to domestic violence, and that the board informs the commissioners on all things related to domestic violence, as well as the use of the 1% food and beverage tax for domestic violence, which is strictly and narrowly defined as the construction and operations of new shelters. So that's what the Domestic Violence Oversight Board does. It's very active and it's very concerned at this moment at our current situation and our previous situation before COVID-19.
Sure, not a new problem.
Right.
And for
As you mentioned, it's a public health issue. Domestic violence is a public health issue all across the world and in our country. So that's where we are. And I'd like to maybe just go into what domestic violence is and what it's not.
please.
Domestic violence is not a disagreement between an intimate partner couple. It's not a marital dispute. And it's not either a anger management issue. It's a pattern of violent behavior or threats of that violent behavior that is thrust upon by the batterer to an intimate partner. And it has to do with a campaign of terror and fear that is thrust upon the victim, having to do with manipulation, intimidation, isolation, persecution, and anything that's having to do with having control and power over that individual, so that the individual basically has nowhere to go and no resources and no opportunity to think for herself and for himself. There are male victims, as we know. So it's all about power and control over the person. And it's a campaign of terror and fear. Every 9 seconds in the United States, a woman is assaulted by her intimate partner. Domestic violence doesn't discriminate, right? We know that at the national studies show that 1 in 3 female murder victims were 1 in 3 female murder victims and 1 in 20 male murder victims are killed by intimate partner. So that's at the national level. LGBTQ individuals are also victims of intimate partner violence, and they face specific challenges to services given the stigma and the prejudice that exist against them. Seniors are also a vulnerable population at experiencing domestic violence. So all these things we need to consider as people are asked to stay home, right? Stay safer at home. We know that victims don't really see that staying at home is really a safe option with their batterer right now. So while we have made significant strides in Miami-Dade County with regards to domestic violence, statistics show that in 2018, there were 8,321 domestic violence offenses reported, and the number of DV-related deaths represented 14 to 15% of all homicides countywide. So as you can see, it is a public health matter, and we're very concerned at the local level. Domestic,
So now,
yes, ma'am.
talk to us about now in this new era. How are things changing?
Things are changing. The services, first of all, I want to talk to the victims and say that they are not alone, that the services are available, and that they can call for help. That we acknowledge that safer at home is not necessarily the case for them, but that the resources and the services with regards to the hotline and every existing service that exists in Miami-Dade County, which includes 2 shelters that are certified with 3 locations countywide, a new shelter that we're building that will add 60 beds to our inventory, making a total of 224 beds for victims. But right now, what we're seeing is a call to the hotlines for requests in economic assistance. Women have lost their jobs because of this pandemic. They have no income, so it's become a affordable housing issue. They can't pay their rent. They can't put food on the table for their children. The majority of the women that are victims come with children in tow. And we know what that experience of domestic violence has on the children early in life. Either they become a future victim or a future batterer. So what we're seeing now is requests for services that we call in the business outreach services, and not necessarily shelter. And it kind of makes sense because they don't feel comfortable enough to leave. They can't leave. So the calls that are coming in are for requests for financial assistance, help with the kids, help with transportation, and basic needs that are
Has
not being met.
increase, thank you so much, Liz, and thank you for the reassuring words to people who are experiencing themselves as victims. We still have our hotline, our shelters available. Can you just say, how do people access that service?
Absolutely. We have a series of hotlines. We have the Coordinated Victims Assistance Center, which is operated by Miami-Dade County, has a 305-285-5900. This is a one-stop center where injunctions and restraining orders are currently being accepted. People can go in there and, of course, observing the social distancing guidelines, can obtain an injunction for protection. We know through the court system that all temporary injunctions that have already been issued have been given a 30-day extension. We're in close call with and communication on a regular basis with Judge Carol Kelly, who's the chief of the Domestic Violence Division, and learned that on Friday that all temporary injunctions have been extended at least through April 17th. So folks can go to the Coordinated Victims Assistance Center.
And say the number again, please.
305-285-5900. There are a variety of services that are being provided through the Coordinated Victims Assistance Center, and they will connect people, if they do need shelter, to the shelter hotlines. Those 3 shelters that I discussed, which is Safe Space South, Safe Space North, and the Lodge.
Excellent.
So they can do that through the Coordinated Victims Assistance Center, as well as receive the other services that CVAC has provided in the past. Naturally, those services are provided by partner agencies, which now some have been reduced. There were a total of over 38 services being provided pre-COVID-19. Now those services are diminished. For example, we can't have one-on-one therapy sessions with the children. The counseling sessions are done some remotely. So that's happening at Coordinated Victims Assistance Center right now. So
thank you.
We urge you to know that you're not alone, to call that hotline. The Lodge has asked also to give their hotline number, which is 305-693-1170. At this time, I want to let the public know what the shelters are doing. They've incurred additional costs, naturally, because they have to sanitize the centers more frequently than in the past. They have made orders. Our capacity has reduced, because let's say in a room where we could fill 2 families, we're only doing, as an abundance of caution, we're only filling the room with 1 family.
Excellent.
If a family, thank God, I'm happy to report that there are no families that have shown any symptoms or tested positive for COVID-19, families or the staff at any of our programs. So I'm happy to say that that hasn't happened, but we're prepared for when the time comes. For example, in the shelters where there's families to a room, we've bought refrigerators and microwaves so that they don't have to come out of their room to get food. Currently, the kitchens are shared, right? They're communal kitchens, so we have a schedule where only 2 families or 2 women are allowed at the same time, and there's a schedule that everybody can have access to the kitchen. But
Excellent.
it's minding the social distance guidelines and all those guidelines provided by the health experts.
Excellent. Thank you, Liz. And tell us, has there been an increase in calls to the police or to the hotlines? What are you finding?
So my conversation with Miami-Dade County Police and the chief who is over the Special Victims Unit and happens to be on my board, he says they're gathering the statistics to make comparisons. I spoke with the major of, the chief of the crimes unit, and he has seen an uptick. They have seen an uptick in domestic violence cases. They're gathering that statistic to report to their partners on a regular basis to see the difference between this year, this month, and last year.
So thank you, Liz. But I will say that I've heard from our police director on our daily briefing calls that generally crime statistics are down. People are not out and about, but that domestic violence is the area where they've seen the increase. And sometimes when they go to a domestic violence call, it becomes very clear that in addition to the use of maybe alcohol or substance abuse, there's also a huge economic factor. Not that that's any excuse, it's given as an excuse, but obviously families or households are really struggling, are very, very anxious with the loss of jobs and the downturn of income. How are they going to pay their bills? And that creates additional stress.
Absolutely. And I just want to clarify, because you know how things happen during a pandemic and during a crisis. Misinformation is received. But the police department wants to make sure that the message is that the police are arresting batterers should an arrest be warranted. The batterers intervention programs continue to monitor and treat the batterers by virtual group meetings and by virtual one-on-one conferencing. So the services continue, the arrests continue, the state attorney's office continues to prosecute batterers, and the judicial system continues. Everybody with a modified approach, establishing the social distancing guidelines, but we definitely want to make sure that people know and understand that the services continue. The courts continue to take intake for those protective orders, and people should know that they are not alone and that they have not been left to fend for themselves. There is help.
Excellent, excellent. Thank you so much, Liz. Now, we are encouraging people to comment, put questions on the Facebook Live feed, and we did get a comment from Kinder Peace Treatment Center. Thank you so much. This is the statement. It can be difficult to cope with fear and anxiety, changing daily routines, and a general sense of uncertainty about the COVID-19. We know that these uncertain times may be difficult for those with pre-existing traumas. Please know that we continue to emphasize that mental health care is a priority during these difficult times of extreme stress and uncertainty, and we will support clients to ensure that you have access to the resources you need right now. Stay positive, stay healthy, stay connected, and be kind to each other. So thank you very much for the comment. In other words, we need to be attending to our mental health needs all the time, right now, and not waiting for things to get out of control. Right, Liz?
Correct. And I just want to add, because we know what goes with mental health, we know what goes with the stress that we are all experiencing, and we know that there's an uptick in the use of alcohol and drugs. And one of the concerns that I hear as I meet with advocates and leadership is that liquor stores are considered essential services. So are firearm stores. So we need to keep that in mind as people are living under these stressful conditions where we know that we don't make the best choices when we're under the influence.
Yes, yes. Some of us might question those rulings, but that is what our governor and our mayor has said. So talk to us a little bit about how you can tell. What are the signs of abuse? Maybe some people might not think that they're being abused, or some others, friends or family, might not think that what's going on is abuse. So what are really the signs?
Well, the signs are what I referred to as isolation. When you see that somebody's being controlled, when a person is not allowed to meet with family and talk to family and friends, when they're not allowed to wear certain clothing, when there's insomnia is one of the symptoms that we see. Drug use, an increase in substance abuse and drinking by the victim as well as the abutter. It's important that teachers, as we're doing distance learning, that we check in with the children and find out and ask them, is everything okay at home? Because the children are very much in the middle of this. One other sign is animal abuse. The new shelter we're building has a kennel that will accommodate participants' pets, because we know that sometimes the pets are the first ones to be in the front line of that violence. So there are things that we can look for, the behavior in children, acting out, not being able to concentrate in their schoolwork or their homework, and just a general isolation, depression, anxiety. And it's important that we ask and that we allow the individual not to think that they have to report it, because that's certainly not where the basis of our services are delivered from. We want to empower the victims to come to a decision on their own as to what is the next step. The shelters right now are ready to do safety planning and danger assessments. So we are doing this on a daily basis before COVID. But we work with the individuals if they want to stay for whatever reason. There's many reasons why victims want to stay in an abusive relationship, having to do with economics, having to do with psychology, having to do with the fact that they don't think they can get away. But there are many, many tools that they can use to be safe and stay safe and look for a way out.
Excellent. And we wanted to ask, what if victims are afraid to go to the emergency room, for example, because of the COVID virus? What would you say to them?
I would say that they should go and that they should get treatment, especially if they're injured, because we have to make sure that you get taken care of. A lot of people are even scared of going to get tested. And I'm not talking about victims, but I think we need to trust that the security is in place and that the procedures and protocols that have been established are safe enough to go to an emergency room when needed.
Excellent. And then this problem of being dependents economically is one we know that is huge. And right now we have so many people out of work, and the unemployment compensation system just gearing up. Our Florida system is overwhelmed. We talked about that in our last Friday, our Community Cares segment. We know the governor is putting new resources into it, trying to clean it up. The county is going to be helping by accepting applications at libraries, so stay tuned for that information very soon. And fortunately, the unemployment benefits are going to be higher than they were otherwise through the state, which was very stingy. The federal level will be higher. And we want to really encourage people to get those economic resources so that they don't feel so helpless or so dependent. And one of our readers or one of our viewers on Facebook Live brought up the point that it's just so hard to get through. There is going to be information how to get assistance, how to file a paper application, where you can go for help to fill out the application. So we want to be sure that it's not for economic reasons that a victim stays and perpetuates the violence. I also want to point out, you mentioned about the teachers for children who are school-aged and might be doing virtual homeschooling. It's really an interesting doorway into the child's home life. So such a good point that you raise. And it isn't a mandated report, but it's an opportunity to reach out to the family or maybe advise somebody else who might be able to assist the family, right?
Absolutely. Absolutely.
Thank you very much for that.
I want to mention, of course, it's always the disenfranchised that suffer the most during a crisis like this. But there's also, if you have a health issue, we have now telecare that you can call in,
Right.
and also get an opinion. So if you have that luxury and that blessing to be able to do that, you don't necessarily have to go to an emergency room.
Yeah, thank you. Both Baptist and Jackson are providing some free telemedicine. That's such a good point. What about paid sick leave? That's something that I've been working hard to bring to our county contract employees, and there's a lot of discussion now at the national level how critical it is to have paid sick leave and family leave. This is a way that an employer can assist in creating some buffer independence, right?
I think so, Commissioner, and anything that becomes a safety net, particularly for victims that are the most vulnerable and those individuals who are lacking our basic needs and the things that we are blessed to have, would be a welcome thing to adopt and support. It's not something that my board has taken a position on yet lately because we haven't had the opportunity to discuss that, but I'm certain that we would be looking at that and making a recommendation.
Thank you. Thank you. That would be wonderful. And for the listeners, I do have a piece of legislation. It's going to be going back to committee whenever we have committee meetings again to talk about ways that we build in paid sick leave for our contracted employees, our maintenance, our housekeeping, security guards, our private transportation workers. All of them currently are without any kind of paid sick leave or family leave. So as we wrap up, and I just want to encourage everybody who's listening to put your questions or comments down on the Facebook feed, and we will definitely get to your remarks. Is there something new that's happening with the domestic violence community, the service community, that you can tell us about?
Well, I know that I keep in touch with our national partners, and what they are doing is focusing on delivering services to victims remotely. So they're setting up the structure for that. They've already started so that victims can access the services remotely. That's the biggest thing that I can say is new for all of us, right? And not just at the national level, but that's what's coming down the pike.
And we are all learning about virtual, right? We're not Zoom babies anymore, but we know for many virtual is out of reach because they don't have access to the internet or devices. So we know that is a challenge, but it's one more way to seek help, especially when we're stuck at home. Hopefully safe. Hopefully safe at home. So let me mention that as a personal note, not only have I known Liz for many years, and it's such a pleasure for her leadership as this service has grown. The need has been understood, dedicated dollars have been assigned, the hotlines, the shelters, the training of our police officers, so many things have evolved where officers really do respect and honor these injunctions and don't assume that it's the victim's fault. I mean, I'm talking ancient history here because our police are with the program. They understand the dynamics. But I'm reflecting that it was 40 years ago that I started my work in the domestic violence arena. So most people wouldn't know that. It was in Georgia, in rural Georgia, and I worked for a legal services program as an intern, and they were getting so many calls from women who were desperate for protection, and the office was not doing any kind of legal work to support them. And I was just crushed by this. And they said, well, you come up with something. You the intern, you come up with something. And we ended up putting together a coalition and a hotline. And so it was a very, very early response. And since then, I moved on to work on the issue of children, the impact of children. I wrote an article, the impact of domestic violence on children. And I'm so happy, Liz, that you raised that point. You know, children, they see it, they hear it. Even if they themselves are not the physical victims, they are certainly the emotional victims, and it's horrifying to be living in a household that is not safe. So it is so, so critical to the well-being of our children. So with that, do you have any closing remarks for us, Liz?
I wanted to say, in terms of something new, I think that we need to learn from France. That was very innovative in terms of helping women be able to come and report the abuse at a grocery store and at pharmacies. So I think that there are many good things that might come out of this tragic pandemic that we can put in place in the future and see how we can deliver services where people are going and not necessarily have them come to us where we are offering the service.
Thank you. Thank you so much, Liz. Great point. We certainly can learn from best practices. Well, we did have an additional comment. Someone pointed out that there's been a big increase in gun sales. And you mentioned earlier that guns and alcohol are considered essential services in our society in Florida, not all over the country, but in Florida and in Miami-Dade County they are. Is there anything that we can say about that increase of gun sales and how it relates to our domestic violence concerns?
I think that it puts everybody at more of a risk of lethality. We saw the Hialeah case yesterday or Saturday, right? Where he locked himself up and held a 9-year-old child in custody and forcing the police to shoot him. And so I think we're going to see an increase in these lethalities, unfortunately.
Yes. Now, our Miami-Dade County Police Department is enforcing legality of gun sales, you know, to close what some call the gun show loophole. We know people sell guns informally. That's not the way it's supposed to be. There's supposed to be the clearance of all gun purchases. So we're hopeful that we'll be able to continue. You know, our police force is very active on the ground in the community, doing a lot of community policing during these difficult times. So let's hope that guns are not getting into the wrong hands in this period, and only to law-abiding gun owners. Thank you for the comment. Okay, so we're going to thank Liz. You've been a great participant. We had a little technical difficulty at the outset, but we think that Zoom is being overloaded with all of us virtually communicating, and so there was a bit of a glitch. And we all are going to be back on Wednesday. We'll have another great show. Marta Viciedo with the Urban Impact Lab will be here to discuss the launch of a new business resource hub that's called axishelps.org. That's AXIS helps.org, so you could check it out. Our local and small businesses are certainly needing all the support we can give them during this pandemic. We are a nation, we're a county of small shopkeepers, as they say, small businesses, and this is a really critical part of our economy. So please spread the word. We'll look forward to seeing you back on Wednesday at 4. And please follow us on social media. On Facebook, it's /Commissioner Cava, one word. Twitter and Instagram is DL Cava. And be safe, be strong, be kind.
Thank you. Thank you, Commissioner.
Thank you, Liz.
Thank you, everyone.
Thank you, everyone, for joining.